Thank you, Chairman Collins and Ranking Member Casey, for holding this important hearing and for your leadership on this issue and on the bold Infrastructure for Alzheimer's Act. Thank you both. I'd also like to thank the witnesses for being with us today and for sharing your personal experiences. The news when a family member or friend is diagnosed with Alzheimer's rocks everyone in its wake. And as all of you know, that official news is one of the many steps in a very long journey. Again, I'd like to thank you all for sharing your stories. This is a question for the entire panel, and we can go down the row if that would be helpful. What is it about the BOLD Act that you find the most promising or essential as we continue to spread awareness and where really we can work towards more of an understanding about this very evil disease? Ms. Harden, would you like to start, please?
Certainly. I don't know the specifics of the act to speak to exactly which is better than, which part of it is better than the other. But what I know about it is that it talks about early detection. And one of the things that really affected my family was that we lost a huge window with my mother. We did not have early detection. And so we lost my mother's voice in determining what she wanted for the rest of her life, how she wanted to live, and frankly, how she wanted to die. And we didn't get to have that question. And so the kids had to answer that question for her. And it's something I never want my children to have to answer for me. So I've been an advocate for early detection. The other thing that I really love when I hear about it, what I'm learning about it, is that it unites the nation. And I think that's such a wonderful future to look to, that it unites the nation as we care for ourselves as we age, that we have a plan. I want a plan, girl. I feel much safer with a plan. And so that is what it feels to me. I had a metaphor last night that Senator Collins is literally in a darkened tunnel with a torch saying, here's the way out, and I'm not getting out until everybody's out. So kind of lighting the path for us, and I think that's what we need. I think we need direction.
Thank you. Doctor?
Thank you for that question. I can't comment on the specifics of the BOLD Act, but I can say that our states across the U.S. are poised to act and to help us with this public health crisis. And the BOLD Act will allow for some national awareness and some convening that could help states really dig in and make a difference.
Thank you. Secretary?
I appreciate the question very much, and I am probably one of the most hopeful people in the room. But I was also taught by my dad to realize that hope is not a plan. So when I heard of the BOLD Act and the folks from the Alzheimer's Association and others who work with us in our state plan on Alzheimer's disease talked to me about the BOLD Act, and then we dived into it a little bit more on our end, Pennsylvania is already well positioned, as I have in my written testimony and briefly spoke about with regard to my verbal testimony. We are incredibly well positioned because of our current infrastructure. We have a state plan on aging under the Older Americans Act. We have a state plan on Alzheimer's disease and other related disorders, and that's great. We have plans. Now, how are we going to put those plans into action? And it's because of the partners, many of whom are gathered with me here today from Pennsylvania, from the Alzheimer's Association. They're Alzheimer's advocates, they're ambassadors, in order to ensure that together, all of us, will work toward that plan of BOLD in particular. Our infrastructure also includes 2 NIA-funded Alzheimer's research centers, one at the University of Pennsylvania in Philadelphia, at the Penn Memory Center, and the other at the University of Pittsburgh. For us in Pennsylvania, we are incredibly excited about the opportunity to actually host an Alzheimer's Care Center of Excellence. We feel that we are leading the way under the governor's administration with regard to all kinds of public health issues. And I mentioned a little bit earlier when it comes to our opportunity to communicate, coordinate, and collaborate our efforts across our health and human services agencies, and the Department of Aging is just but one part of that. The Department of Health, the Department of Human Services, the Department of Drug and Alcohol Programs, the Department of Insurance, the Department of Transportation. I can go on and on and on. But we need to better work together, break out of our silos, which is probably the most overused words ever, with regard to how we're going to use the resources.
But also the most important.
I agree. How are we going to use the resources entrusted to our care? Whether they're resources that come, thankfully and gratefully from the federal government, whether they're taxpayer dollars, whether in the Commonwealth of Pennsylvania, 75% of our budget at the Pennsylvania Department of Aging comes from the Pennsylvania Lottery. So hopefully everybody here will buy a Pennsylvania lottery ticket. Benefits older Pennsylvanians, got to play to win. But that does support the work that we do, which is why I will so passionately advocate for the BOLD Act and why I really wanted to pivot my testimony towards the Older Americans Act, which is often not the third pillar of the stool of those three main federal entitlement programs, such as Medicare and Medicaid. But we have an opportunity to bend that cost curve by providing better services, low-cost, high-quality services, and the homes and communities of our older Americans. We can do so much better, and this BOLD infrastructure will allow us to do that.
Thank you. Doctor.
I think whenever I hear things like early diagnosis, I think what I guess excites me as a researcher is that the earlier we go, the better, the more likely therapeutics will work. And so as a researcher, this act would allow us to get at earlier and earlier stages of Alzheimer's disease that we can then both understand through basic research in, for instance, animal models, but also then using them as a discovery tool to then turn the question on its head and to ask whether what we've identified in our animal models of disease actually reflect what goes on in the human population. Because it's certain that the earlier we start the treatment, the more successful that treatment will be. And I think as an advocate with my friends from the main chapter of the Alzheimer's Association, I get a lot more of an understanding about advocacy and care, and that seems to be exactly what's needed.
Thank you.
Excuse me. Probably should push the talk button. The BOLD Infrastructure Act, it comes home to me in a number of ways. In the late 80s, my first husband was diagnosed with cancer. And the biggest thing for me was having a roadmap. What world am I going to do? Where am I going next? What is the plan? What is the infrastructure? And with cancer, that's laid out for you right away. You know, you're diagnosed, we're going to do this and this and this and this. And it gives the family members and the person who is fighting the disease an understanding of what's going on, but they have more sense of control in exactly where their life is going. And with control, it decreases the amount of stress for a caregiver and certainly for somebody who has some sort of disease. One of the things that I've learned that has really just taken the breath out of me at times as I've been involved with Alzheimer's is the number of people who don't come under what we would normally call older. The people in their 40s and 50s, I mean, I'm just over 60. Now the whole world knows about it. It's on C-SPAN. But and I don't consider myself older. But I mean, when we're seeing people in their 40s and 50s and 60s that still should be productive members of this society that don't come under any act for older people, and they're given this diagnosis, it will absolutely, we were thrown for a loop. But we expected my dad was getting older, but if that was in somebody in their 40s and 50s or 60s, just imagine what that does to your life when you still have children at home, when you still have huge responsibilities for caregiving for your family, but also probably as productive members of society. 50% of the people that are living with this disease have yet to be diagnosed. This has got to be a public health issue. People that don't have access to facilities like the Medical University of South Carolina. I'm blessed to live where I live because we had lots of resources, people that were willing to see my dad on a short-term basis. People that are in the rural areas do not have that kind of access. So this has got to be a public issue, a public health issue. We have got to establish centers of excellence. So we look at brain health. We look at brain health. As I've been told by physicians, the brain is probably one of the least understood parts of the human body. That's got to change because it is absolutely impacting the ability of people to enjoy their lives the way that they should.
Thank you. As most of you here, my family has faced this terrible disease. I thank you for what you do.
Thank you.
Thank you very much, Senator, and thank you for your co-sponsorship of the BOLD Act. Senator